Welcome to Community News Media. I'm Lori Nussbaum, and today my guest is Dr. Michael Arencibia from Coral Gables Animal Hospital. Thank you. Can I call you Michael?
Absolutely,
okay.
yes.
Thank you for being here today, and I have to first say thank you for being Hazel's doctor, because she's doing amazing. So,
Awesome.
Okay, now that I got that over with.
Thank you for having me.
So tell us about your journey and how you got here.
Cool. So my name is Michael. I'm from Miami, born and raised here. I'm of Cuban descent. My parents, my dad was born in Cuba, my mom was born here, but essentially they raised me here, went to Westminster Christian for high school, eventually found my way to the University of Miami. I got a degree in microbiology and immunology with a minor in chemistry. Then from there, I was blessed enough to go to Midwestern University in Phoenix, Arizona, a 4-year degree program. So a good amount of it was over there. They let us come back home, or at least other parts of the country, to try different external sites. Ironically enough, that's how I found my way to Coral Gables Animal Hospital. The staff liked me enough to keep me around, and Dr. Richter, Dr. Thomas, Dr. Pereira, and we all kind of banded together and kind of have the practice that we work on now.
That's awesome. And your passion for becoming a veterinarian.
Yeah, so initially I didn't even know if I wanted to be a vet. Mm-hmm. It started more so with the interest of anatomy and dissections in middle school. Once I got to high school, a little bit more advanced in that stage, and we had a class where we were able to see different career paths outside of just kind of normal summer stuff. I found my way to an orthopedic surgeon. Like I said, I always enjoyed dissectioning and all that stuff. So essentially didn't think ortho was my route. It was very laparoscopic or scope based, and I enjoyed seeing things wide open. And essentially found my way to a veterinarian. My dad's best friend has been practicing veterinary medicine at that point probably close to like 25 years, and spent the whole summer with him, and it was awesome. We got to do a lot of cool surgeries, and that's kind of where probed my interest. And then more summers, you start to fall in love with it.
And you have animals.
I got 4 of them.
Tell me about your animals.
It's pandemonium always in the house. So I have a chocolate lab. His name is Bo. I got him in college, and he's the absolute love of my life. The guy is awesome. He's almost 7. No, he just turned 7, about to turn 8. So he's starting to get his whites. But then there's also Leo, a golden retriever of ours. My sister's dog has an Australian Shepherd, so he's a ball of energy always. And then my mom has this little white pocket poodle named Milo, so that's kind of the core 4 that we have at the house.
And they're great animals. I would say, so I've heard that the poodle, they're like amazing dogs. They don't give you any problems. They're really smart. Why? Why is that?
Well, the origin actually behind poodles is that they're a French dog that was used for hunting. So the reason why they have kind of like that odd haircut was for buoyancy, for duck hunting. And they've kind of evolved from those smart brains. And it's funny, we have a story, but we were in the west coast of Florida, and the dog went to the beach with us, and we were in the water. I had no idea that he knew where the chair was, but when he was done with the water, he just ran, and we were in the 3rd row of chairs, and he just found the chair, sat under it, and just lived the dream from that point on. So yeah, poodles are a very smart breed.
So tell us a little bit about your duties, what you do at Coral Gables Animal Hospital, the different things that you specialize in.
Sure. So I'm typically on Tuesday through Fridays and every other Saturday. I get 2 surgical days a week. That kind of just depends on what presents. A lot of my time is in dentistry and in soft tissue surgery, whether that be standard castrations or we're doing a mass removal or just dental cleanings in general. So those are my 2 anesthetic days. And then in the afternoons and Tuesday, Fridays, I'm seeing medical cases, whether they're showing up for updating vaccines, my pet's sick for XYZ reasons, and let's try to address them and provide some treatment. But that's kind of where I start my routine.
And let me get back to dentistry. So with animals, I mean, is it a specialty? Do people like with human care, people go to different specialists? Does that happen with animals as well?
Absolutely.
But we had spoken, and you mentioned that dentistry is a big deal now with animals.
So I think owners are starting to realize it. I think the first thing they'll pick up is like the bad breath. But when you start looking into the dog's mouth, if they let you, you don't want to be in there too long and, set off their fuse. But it can get a little bit more advanced, and as the more time passes, you see a lot of accumulation of what initially becomes tartar and then eventually calculus. And then what the difference is that calculus is like a hard film that will grow on top of the crown of the tooth, or what we see on the outside. And if you allow that to stick around for too long, it could start diseasing the gum that we will see with our naked eye. But what we don't see with our naked eye is the underlying bone, and it could really just kind of become a big problem just from not being on top of your dental care. There's things that I try to tell owners to do at home,
right.
But with even my own dog, I know it's challenging to kind of stay up to speed with my own recommendations. But dental care is a huge, I think, emerging aspect of the field that we're starting to take a lot more seriously. And you can prevent a lot of health problems by just maintaining good teeth.
So can you tell us, like, preventative, what can we do? I mean, I know that I have a toothbrush and I should be brushing Hazel's teeth.
Right.
I get lazy and, I sometimes clean them, but they have that bad breath, and or you see a little tartar on the back teeth. So what could you recommend that we could do preventatively?
So at home care, it's challenging for me to tell you, hey, put a toothbrush in your dog's mouth. They might not enjoy it, but there's always an aspect of you could always positive reward it if they allow you in their mouth. But other tools, there's like little wipes that you could put. They almost look like makeup wipes that you wrap around your finger and just run them along the teeth. I try to have owners at least do that maybe once or twice a week. It doesn't have to be a 2 times a day thing, but it certainly will prolong the intervals of time between dental cleanings. You typically see a dog show up with a fair amount of gunk that we should remove about 3 years old of age. And once we have one on record and we're able to establish what's a good interval of time between dental cleanings, if you do the work in between, you can prolong that time frame, and it's just beneficial for them long term.
Right.
Other tools that we like to use, and I find it ironic because I don't enjoy celery, for example, but celery is a great tool as a treat that gives the good crunch. It acts like a bristle to rub on the crowns of the teeth, and just a good at-home trick to try to keep the teeth clean. Carrots as well. I give my dog carrots. I think part of it, he enjoys the crunch, but that hard substance on the crown of the tooth helps at least rub or potentially crack whatever it is.
So I actually cook carrots.
Mm-hmm.
So you're saying, like, cook them or give them raw?
I've seen them under both circumstances.
Okay.
I think my bigger concern is getting them an appropriate size where they can have a hard bite and crunch. It's good for stimulating at least the masticatory muscles, but also just making sure they're the appropriate size, because I have a chocolate lab. If I give them a little carrot this big, it's a choke hazard.
Right.
So
right.
I would say make it size proportionate.
Got it. Okay, let's talk about some of the things that we had discussed previously that you wanted to touch base on: nutrition and diet for your pets. What do you recommend?
So I think the big money-making statement within any dog food would be the AAFCO statement, or AFCO. They're basically the overseeing body that says, hey, look, this diet is set to meet all nutritional needs for the patient. Important aspects as well as that dieting is to have age-appropriate food. So I wouldn't give a puppy an adult food, and you shouldn't give an adult dog puppy food unless if they're lactating. It's a different conversation. But in those settings, you're able to get age-appropriate nutrition. When you have that in combination with the AFCO statement, I can confidently tell you, hey, we don't need to supplement micronutrients along the way. But other aspects to that, there's other food brands that are outside of the big three. I know everyone knows about Hills, Purina, Royal Canin. Those are the main ones, and we use prescription diets through them if need be. But other dog brands like Blue Buffalo, like Farmer's Dog, a local one, Winwood Dog Food, they all have the AFCO statement that you're allowed to expand what the market has to offer. The only thing that I have a comment about as far as diet that we're starting to know now is Grainfree has kind of had its chance at the market.
And I was going to talk to you about that. I wanted to mention that, your thoughts on the whole grain-free thing, because I was actually going to give my Basset Hound Hazel the grain-free, and you all mentioned that grain-free is just a thing, it's not 100% approved, and she's a kind of dog that has a stomach issue and was going outside and eating things, and now you recommended that she's on that Royal Canin diet.
Yeah, so what we've learned about grain-free diets is that we've seen a connection with those, and then cardiomyopathies or just anatomical changes to the heart in a negative way. And what we've seen over the course of time is we might have a dog that I just didn't even know how to murmur, and on a normal exam, I hear one and I'll talk about diet. And what we'll know is that that connection of grain-free diet will change to thinner heart walls on the ventricles or that bottom half of the heart. So if I can try to have my patients eating appropriate diet early on, I can prevent a problem like that we'll have to manage later on in life. So I think that's the big bugaboo right now. And it was a great marketing spot that they took.
I was going to say, yeah.
And I think we just know more now.
And what about people going out and buying I think it's the farmer's dog that's so expensive.
Yeah.
Is it necessary? What about cooking your own food for dogs?
So cooking food, that becomes labor intensive. Ironically enough, my mom did it when I was gone in school. For my dog suffered from allergies. He cannot have chicken or beef, which makes it really fun. But it's a very labor intensive job per se. And you may start even missing macronutrients involved. So there are veterinary nutritionists involved that you can get professional insights, and they have products that they may tell you, hey, why don't we supplement with this along with what you're doing at home. So it's a tricky place. I know it comes from a good heart, but it ends up becoming very labor intensive, and it might even offset your cost at home.
Got it. Okay, so let's talk about pet insurance and the importance of it for veterinary care.
Yeah, so I mean, I think we've all seen costs go up and everything associated with today's day and age, but pet insurance has been huge. So much of what we see now is we have a patient and we've been able to identify a problem, but sometimes resources can get in the way of providing top level of care. And what we see is pets that have insurance have a better chance at least getting everything done or most of it done. In our practice, we have a lot of experience with a company called Trupanion. I'm not getting paid by them for any source of knowledge, but Trupanion has been great. One of their examples is that they'll allow you to submit an estimate. So I found XYZ during the exam. I think we should do ABC. And I could submit it to them, and they'll give us a number within 5 minutes saying, hey, look, this is what we'll cover. This is what the owner would have to essentially pay out at the end. And it's been a huge buffer between the side of the finances versus what the medical care is needed. And I think it's been a great trend in the industry and in the field. And I'm hopeful that it continues to grow. And I think there was something in school where they told us like maybe 10% of pets in America are insured. So we're hopeful that goes up.
Yeah, that number really needs to go up. Because I find that I've had pet insurance with all of my animals. Maybe years ago I didn't. But then costs come up, and then people, it's crazy. You could be spending thousands and thousands of dollars.
Absolutely. And I think what's good to know now in how the insurance works for in veterinary care is typically you're going to see a plan between having wellness care covered versus emergency or disease-based stuff. So if you were in the realm of, okay, I want to have the yearly stuff covered, I don't want to handle those kind of costs, there may be an insurance company that caters to your want. But then if you're okay with having the normal wellness stuff not being covered, but whenever something bad happens and you have an ER visit or you are seeing a GP like us and we need to do several treatment plans, then that's when they'll chime in. So I think it's well to know that there's different options in the market, and they will cater to how you want to be covered.
Let me just ask you a question. There are specialists for different areas like neurological care, and do you handle that, or do you go to another doctor, and will insurance cover that?
Insurance starts to get tricky. That's kind of beyond where I know insurance wise, but what the kind of normal flow is if a patient presented for, let's argue, a surgical orthopedic problem. My dog is limping on his right knee and I don't know why. We'll do our own physical exam and assess the problem, and if we can identify, hey, there's a torn ACL, or in our world it's called a cranial cruciate ligament, that would involve a specialist. So there's orthopedics, there are internal medicine, neurology, and there's even dentistry specialists as well. some will travel. You see the traveling people that come about, but then there's also multi-specialty care services throughout the country, really. But then those are the kind of places where you'll see everyone together. Oncology is another one that you see as well. So there's a pretty vast range of specialty that you can do that does entail more training following your graduation from veterinary school, but they're all amazing people, and they all really do their best to provide top-level care.
What is your role of preventative care in maintaining pet health?
Sure. It's always easier to prevent than treat. So our standard setup whenever we have a patient that comes by, it'll always be, hey, make sure we're up to date on yearly vaccines, make sure that we have a fecal sample so that we can assess any parasites going on, and our monthly heartworm flea tick prevention. So that's a big kind of one that kind of goes under the radar pretty easily, and it's something that we see a lot in Miami, especially with the high mosquitoes. That's the big vector for heartworm disease. But things of that nature that help me tell you, hey, look, this is what we should be checking our boxes every year. We're providing you top level of care. As patients get older, you may want to consider doing yearly blood work or maybe every 18 months just to make sure that the internal organs are working appropriately. And if there are deviations from normal, we can start diving into them and assess an early treatment plan. So those are kind of the early preventative steps that I would say you can expect at a typical annual exam. But as anything goes on in life, there will be changes, and it's always easier to catch them when they're early.
Got it. No, totally makes sense. All right, I have a question that I want to ask.
Sure.
What is the deal with there was such an uptick on doodles, the Labradoodles, Golden Doodles,
Okay.
the Frenchie, and what is I mean, these mixed breeds?
Sure.
Is that, I mean, they're adorable animals.
Right.
Why?
I think people try to put together everything that they like into one breed. So you'll have a golden retriever everyone loves, almost thinks of it like America's dog, where you have the poodle that are very smart, very resilient. And when you try to add them together, you try to combine their better traits into one. What I see a lot of the times is you have owners that come out and they're like, oh my God, this dog is rambunctious. There's always high energy. And
Right.
and that's kind of normal, especially when they're puppies. I just think it's kind of one of those things where they see two breeds that they're like, oh my God, these are gorgeous. Let's put them together. And that's how we've almost evolutionarily wanted.
Yeah, in the last few years,
They're popping up everywhere.
Everywhere.
I hear a new doodle probably every 2 months.
Right. Yeah. It's crazy. What can you share with us? Anything that you want our viewers to hear about or that you can recommend?
Sure. I would try to always say you want to have at least a doctor see your pet maybe twice a year. I know sometimes it's a demanding ask, but in the scheme of it, a calendar year to us may not be as important to a pet, but there's a notion that every year is 7 dog years. More or less when they're older, you might fall along that timeline, but doing blood work once a year is almost equivalent to us if we're following that same time scheme is if we're doing blood work every 7 years. So it's of value to make sure that we're at least on top of those kind of things. Another aspect that we want owners to kind of be aware of is that we're really just trying to give you top level of care. I think there's always a negative notion when you visit a veterinary clinic that they're looking for problems, but it's not necessarily it. I would always say, and the way I believe my job is, if I see something, I say something. And we just try to provide you top level of care. In my view, I always want to make a partnership with the owner and the pet so that we can at least say, hey, look, if we're going to focus on one thing, let's dive into this. And I think when you allow that communication to happen with owners, they tend to gain your trust, or you gain their trust. And at the end of the day, it's always going to be a positive outcome for the pet.
So we have a couple seconds left. I want to thank you for being here.
Thank you for having me.
Thank you for your expertise and sharing what you want to let everyone know where they can reach you, and contact you. They need a new vet.
Yeah, I'm always willing to take on your little furry friend. But I practice medicine at Gables Animal Hospital. It's right behind the Lifetime and Trader Joe's, right south of Merrick Park. It's a great place to be. They have a lot of top level care there, but you could also, we started a new Instagram called Dr. Arencibia. We plan to post some content on there. At least I have a little bit of learning to provide for the internet, I guess, per se. It's a new world out there, so we try to do that. But yeah, I'm just always ready to help your pet.
Well, thank you so much, and thank you for taking care of Hazel, because she's my furry pet and a basset hound, and I thank you.
No problem.
So thank you very much for being here. Happy Thanksgiving.
Happy Thanksgiving to